What happens at a breast cancer follow-up visit? In this video, I'm going to be talking about what doctors look for when they see you in follow-up visits and why you should even go. I'll also cover who can do your follow-up for you. Why do we have you come back? Well, the reason we have you come back is because you've been through a lot. In general, the point of follow-up visits is to look at your overall health and recovery and to see how you're doing as a whole person. It's not necessarily a search for cancer. We're not going in to give you bad news. We're going in to assess you as a whole human being. This is not just about making sure you're okay. It's helping manage long-term and late side effects of treatment. It's about monitoring how you're doing on any medications you're still on. You might be on a PARP inhibitor or endocrine therapy, and your doctors want to know, how are you tolerating treatment? How's it going? What side effects are you having? We also do a really good physical exam. So a physical exam after breast cancer treatment is looking for obvious, curable, or easily detectable with the physical exam tools we have, which are our ears, our eyes, and our hands, to see how your body is doing. So I'll talk about the physical exam in just one moment. The other reason we see people in follow-up is to see how you're doing psychologically. How's your mood? How's your sleep? How's your intimate life? How's your social health going? How are you doing otherwise? How are your other medical problems? For example, if you've had an anthracycline, if you have other medical problems that were caused by the treatment, we want to follow up, and as specialists, the doctors want to know, are there any late or long-term effects? All right, I promised I would talk about the physical exam. The first thing we do, and this is really hard to explain, is we look at your overall, how you come across, your hop up on the table test, I call it. Are you able to do what you did before? How's your mobility? How are your spirits? Do you have a twinkle in your eye, or are you looking really down or really flat affect? How do you appear as you sort of walk in the door, or as we walk in the door to see you? You can learn a lot from people just by the way they respond to, hello, how are you doing today? You know this from how you can see this in your family or friends, other people in your life. The next thing we'll do is look in your mouth. If you're recently finished treatment, we want to see, how is your mouth? How are your teeth doing? Maybe you had mouth sores during treatment. How are those? The next thing we'll do is feel for any palpable lymph nodes. Lymph nodes are those glands that we have all throughout our body that can become enlarged or can develop a firm texture if cancer recurs in them. Now, not every enlarged lymph node is cancer recurrence. In fact, most enlarged lymph nodes are not, but this is one thing we can feel. So we will feel your neck in the front, we'll feel in the back, we'll feel over your collarbones, and we'll feel under your arms. Depending on the type of cancer surgery and cancer that you've had, we may also feel for lymph nodes in your groin. Breast cancer generally does not recur in the groin lymph nodes, but if you're watching this because you've had another cancer, that's another part of the body that might be examined. We also will listen to your heart. Are we hearing the normal lub-dub, or are we hearing a murmur or an extra sound when we listen to your heart? We'll listen to your lungs. Are they clear? When you take a deep breath, is air going equally on both sides? It's actually a little bit higher. Your diaphragm's a little higher on the right because of the liver, but are we hearing good airflow in the front and back of your chest because we're listening to your lungs? Many doctors will also see if they can feel the edge of your liver. If we do, it's not necessarily a problem, but if it's tender or if there are other findings like jaundice of the skin, this will prompt additional evaluation. We may also feel for the spleen. Some doctors, we just do the same routine every single person, because if you start skipping things, you lose that habit that we've been trained to embark upon. We will also look at the swelling that you may have in your hands or arms, in your feet or ankles. All of those are things that can tip us off to lymphedema, for example, or if legs are swollen or feet are swollen, to problems with the heart, for example. Again, not all of these indicate a recurrence, but those are the kinds of things we are looking for. If you have symptoms, if you have headaches, if you have shortness of breath, if you have nausea or other problems, we will do an even more detailed exam of that part of your body. If you are without any symptoms, which we found when we take a good history, we'll ask, how are you doing? What have you noticed in your body? These are the types of things that we do routinely. So if you have no symptoms, that's the routine physical exam that we'll do. And we also look at the skin. We look at the skin on your chest wall if you've had a mastectomy, and we do a thorough chest exam if you've had a lumpectomy or even a bilateral mastectomy. We do a really good exam of, in particular, your chest and chest wall. If you have specific questions about your particular follow-up, I'd love to invite you to go to yerbba.com to get your personalized Yerbba report. There you can see questions to ask your doctor. That's one of my favorite features. And you can ask questions if you get the premium version, where you can ask us questions in particular for your case. So those are the main things that happen. If you have questions that you brought to the appointment, the most important thing is to make that agenda clear at the beginning. Don't hide your questions for your medical providers in your pocketbook or your pocket. You want to bring those out early on, otherwise you may not have your questions attended to fully. It's also really helpful for your medical team to know what's on your mind, because that helps them use the time in a way that serves you best. So when you walk in, you have an agenda. It might be, am I okay? Or it might be, I'm having these 3 problems. Your medical team also has an agenda. How's my patient doing? Is there anything abnormal on their physical exam or in their history I should be thinking about? Are they experiencing symptoms or side effects of treatment? We want to make sure that both agendas are met. So let your medical team know what's on your agenda for this visit. So that's a brief capsule of what happens in a follow-up visit. This topic was one brought to us by a viewer. It was a suggestion for a video. So thank you if that was you. Thanks as always for watching, and we'll see you next time.